Hi, I'm Jeremy Garcon, and I'll be the student nurse for today. And my patient here is.
My name is Whitman Semperville, and I am allowing Jeremy Garcon. I'm giving him consent to show to Miss Professor Laban to view.
Thank you.
Yes,
Hello, hi. My name is Jeremy. I'll be the nurse for today. How are you?
I'm doing fantastic, and yourself,
I'm
sir?
doing amazing. What's your name?
Whitman.
May I see your tag? And what's your date of birth?
12/10/89.
Okay, perfect. Do you have any allergies today?
No, I don't.
Okay, so I'll perform your physical assessment. Is that okay?
Yes.
Okay, perfect. So I'm just gonna wash my hands and put sanitizer on and just put my gloves on, okay?
Okay.
Do you know where you are right now, your patient?
Yes, I am currently in the hospital.
Okay, perfect. And do you know what year it is?
Yes, it is 2020.
Okay.
Worst year of my life.
Yeah. Do you know what the president is?
Yes, Donald Trump.
Yep, A03 check. Alright, so the first thing I'm going to do is I'm going to inspect your head. Just look at it, alright?
Alright.
Alright, so right now I'm just like feeling your head. You don't have any lumps, no lesions, no pediculosis, no signs of any type of trauma. Do you have any pain here today?
No, I don't.
No? Alright, so now I'm just going to inspect your nose now. Do you have any pain here today?
No.
Do you have any type of difficulty smelling or breathing, anything like that?
Not that I know of. I think I'm pretty fine.
You haven't had any surgeries, I don't know, nose fractures in the past, something like that?
No.
No? Okay, that's perfect, great. So I'm just going to look inside your nose really quickly, see if you have any type of lumps or any excess drainage or anything like that. Alright, so now next thing we're going to do is we're just going to test your smell. Can you close your eyes for me really quickly?
Yes.
Okay. So, can you cover, I'll cover for you. Alright. So can you give me, do me a favor, smell this for me? What does that smell like?
It smells like alcohol.
Okay, do another deep smell. Smell it for me.
Same thing. Smell like
Perfect.
alcohol.
Alright, perfect. Your olfactory nerve, cranial nerve number 1, intact. Alright, so now the next thing I'm going to do is now.
Can I open my eyes?
Oh, yes, you can open your eyes.
Okay. Sorry.
Alright, so next thing you're going to do is I'm going to look inside your eyes. Okay, your conjunctiva is pink, nice and healthy. Your sclera is white, great. Do you have any trouble seeing your glass or anything like that?
No.
You don't, are you farsighted, nearsighted?
I'm nearsighted.
Okay, great. Alright, so can you do me a favor, please? May you read what it says on my badge, please?
Yes, it's a Jeremy Garcon, student ID.
Perfect. Now, see that sign over there? Can you read that for me, please?
Yes, that says exit.
Great. Alright,
Or I can add something that says exit at the door. No, I'm just kidding.
Okay, anyways, so now I'm just gonna do me a favor, please, and just look at this. Look over here, please. Alright, your pupils are size 4, great. Pupil size 4, okay, great, perfect. Now just look into the light, please. Alright, perfect. Your pupils are constricting. And they dilate normally. Your pupils are consensual, great. So now I want you to do me a favor, please. Just follow this pen. Don't move your head, just follow the pen only with your eyes. Perfect. You're doing really well. Great. Alright, perfect. Alright, and also follow this pen, please. What I'm doing right now is I'm testing for convergence, seeing if you're cross-eyed, and your eyes cross normally. It's really well. Alright, so cranial nerves 2, 3, 4, and 6 are intact. Alright, so now I'm just going to test your face to see, make sure everything is good. Do you have any type of discomfort or tenderness or anything like that?
No.
Okay, great. Your face seems to be symmetrical, no signs of edema, anything like that. Okay, great. So, the next thing I'm going to check is, can you close your eyes for me?
Yes.
Alright, so let me know what side of your face I'm touching.
My right.
Great. This side?
Left bottom.
Okay. This side?
Left top.
Okay.
Both of my side of my cheek.
Perfect. Alright, so cranial nerve number 5, facial, intact. Alright, so the next thing I'm going to check is, can you do me a favor, please? Can you puff your cheeks up? Great. Now lift your eyelids. Now stop puffing your cheeks. Smile. Great. Alright, everything, cranial nerve number 7, facial number 7 is intact. Alright, so the next thing I'm going to do is I'm going to check your ears, okay? Do you have any problems hearing?
No, I don't.
Do you wear a hearing aid?
No.
Okay, great. Alright, so I'm going to look to make sure your ears are symmetrical. Everything seems to be great there. So now I'm just going to look inside of your ear. Oh, I'm going to feel it first, actually. Any type of tenderness, no discomfort here, right? Nothing, right?
No.
Alright, perfect. So now I'm just going to look inside of your ears for any excess cerumen. Your ears look pretty clean. You don't have no scars, anything like that. Check the other side of the ear. Alright, perfect, perfect. I can see it's very clean in there. You don't have any trouble hearing.
No, not at all. Cause I mean, I cleaned my ears yesterday.
Okay, perfect. So alright, so cranial nerve number 8, auditory is intact. Everything seems to be well there. So now next thing I'm gonna check is your mouth. Open your mouth for me, please. Alright, I'm looking at your soft palates. Everything seems to be great. Yeah, in discomfort today, you close your mouth. In discomfort today, no bleeding when you brush your teeth. Everything is great. You're doing brushing your teeth right. Your oral hygiene is great.
Yes.
Alright, great. So now do me a favor, may you open your mouth, please. Lift your tongue up. Touch the top palate, great. Your frenulum is intact. To the right, swallow the light. Down. Perfect. Everything's great. Your mouth is intact. So cranial number 9, and 12, and 10 are intact. Everything seems to be great there. Alright, so now we're just going to continue with your assessment today. Alright, so do you feel any type of pain here in your shoulder, anything like that?
No,
No
sir.
discomfort, anything like that?
No, sir.
Okay, so great. So I just need you to push down on my hands for me, or push up, excuse me. Okay, down again. Okay, perfect. And I'll just push my hand this way. No, like this. Okay, perfect. Now try again. Okay, perfect. Now may you look up for me. Now look down. Now look to the left. Lift your head up, look to the left. Now look to the right. Now your left ear on your left shoulder like that. The right ear on your right shoulder. Now just do a circular motion for me just like that. Perfect. Cranial nerve number 11, spinal accessory, is intact. Alright, so the next thing I need you to do, may you move your shirt for me, please?
Yes.
We're just going to check your lung sounds. Alright, so now next thing I'm going to do is palpate your neck. Okay, your trachea is midline. Everything seems to be great. May you swallow for me, please? Okay, perfect. Let me check your skin turgor. Okay, great. You seem to be hydrated. You've been drinking. Great. Now I'm just going to check your pulse. 1, 2. Alright, +2 normal. Turn that way a little bit, please. Taking this side. Alright, great. +2 normal. Everything seems to be great. Now I'm going to check it with my stethoscope. Okay, +2 normal. No bruit. Breathe in, breathe out for me. Breathe out. Let me try the other side again. Breathe in, breathe out. Okay, everything's great. Now, just look over to the left side for me, please. Okay, no sign of JVD. Alright, now look that way for me, please, again. Alright, no sign of JVD. Alright, everything seems to be great on your neck. Now, may you remove your shirt for me, please? So I can check your lung sounds as well. Alright, perfect. You can sit down. Alright, so, okay. Every time I move, just breathe in, breathe out, okay? And now I'm checking your bronchial sound. Alright, 1, great. Now your vesicular sound above the clavicle line. Breathe in, breathe out. Perfect. Again, breathe in, breathe out. 3, your bronchiovesicular sound is good. Now next, your second intercostal space, a bronchiovesicular sound. Great. Across to the other side. Breathe in, breathe out. Great, perfect. Now fourth intercostal space. Breathe in, breathe out. Perfect. Now across the other side. Breathe in, breathe out. Alright, now fifth intercostal space. Now breathe in, breathe out for me. Perfect. Strong lungs. Breathe in again. Breathe out. Alright, perfect. Alright, your lung sounds seem to be great. Now, do me a favor, please. May you just turn around so I can hear the back sounds, please? Okay, perfect. Alright, so now I'm going to check your back sounds. Alright, so I'm going to start up here. Okay, breathe in, breathe out. Perfect. 2. Okay, perfect. Now second intercostal space. Perfect. Now across the other side, second intercostal space. Perfect. Now here, fourth intercostal space. Breathe in, breathe out for me. Perfect. Alright, across the other side, deep breath. Perfect. Now we're going to sixth intercostal space. Breathe in, breathe out. Perfect. Across the other side. Breathe in, breathe out. Alright, almost done. Then the mid axillary line. Breathe in, breathe out for me. Great. And then, go ahead. Perfect. Alright, everything seems to be great here. Alright, so now I'm just going to check. Maybe, stand up for me. Now you're more comfortable for you. Now just turn around and just check the back to make sure everything's equal here. Alright, so I'm going to need you to breathe in and breathe out for me. Perfect. Your lungs are equally bilateral. Everything seems to be great there. Now you can just take a seat there for me. I'm just going to make sure that check if you have any sign of barrel checks or anything like that. I'll come on this side. Okay. Everything's going to be equal there. Check this side. Okay, perfect. He has no signs of barrel checks or anything like that. Everything seems to be really good there. Alright, so now we're going to check your heart sounds. Alright, you ready? There you go. Okay, perfect. Alright, so it's on a second intercostal space to the right of the sternum is the aortic valve. Alright, perfect. Your S2 sounds are louder here. Now across the other side, second intercostal space to the left of the sternum is the pulmonic valve. You don't have to breathe in, breathe out, you're good. Alright, perfect. S2 sounds are louder here. Now I'm just going to slip down a little bit. The third intercostal space is where the Erb's point is. Alright, perfect. Your S2 sound and S1 sound are both equal. And then right here is going to be to the fourth intercostal space, your tricuspid sounds. Alright, great. Your S1 sound is louder. And then right here is a fifth intercostal space, your mitral valve, where S1 sounds are louder. Yep, S1 sounds are louder here. Alright, perfect, great. Alright, your heart sounds seem to be really good. Everything seems to be intact. Seems like a healthy guy so far. Alright, so next I'm just going to be checking your abdomen area. Maybe lift your knees up so I can put this under. Okay, perfect, just like that. Perfect. Alright, so I see you don't have any lesions, no moles, no scars, or any pain in your abdomen area? No? Okay, perfect, perfect. Alright, so now I'm just going to listen to in between your umbilicus and your xiphoid process right here with the bell. Listen for Bruits. Okay, perfect. Alright, yeah, he has no sign of Bruits or anything like that. So now next I'm going to listen to each quadrant here on your abdomen area, okay, for 1 minute. Alright. Alright, so your right lower quadrant. Alright, so I heard about 33 sounds there. Everything seems to be normal there. Now the right upper quadrant, another minute. Sir? Alright, I heard about 32 sound, everything's normal there. Now your left upper quadrant. Alright, heard about 33 sound, everything's normal there as well. Now the left lower quadrant. Another minute. Alright, perfect. Everything seems to be normal there. You have 33 sounds as well. Do you have any discomfort here in your abdomen area?
No, I don't.
Alright, so now I'm just going to palpate your abdomen area, okay? Let me know if you feel any discomfort. Alright, perfect. Alright, so you can just sit up for me now. So I do want, you can put your shirt on as well.
Okay.
So I do want to ask you, do you have any type of discomfort or any problems peeing? Do you have any heartburn, any reflux, any problem with your appetite? Do you check your testicles monthly, things like that?
Yeah, everything's fine.
And do you also check your scrotum area to make sure no sign of odors or any bacterias or any lesion or anything like that?
Yes.
Alright, perfect. Alright, so now I'm just gonna inspect your skin. You can see. Alright, your temperature seems to be fine. You know, lumps, no lesions, no scars. You don't have to flex either. Everything seems to be fine there. Okay, perfect. Now let me see your fingers. Alright, I'm just gonna press on each of them. Checking your capillary refills. Everything seems to be fine. Alright, perfect. Let me see arm like this. Alright, let me check your pulse on this, your left arm. Alright, there's your reading. There's your brachial pulse. Everything's +2 for both. Let me check on this arm. Perfect, +2 normal on this side. Alright, I checked both arms. Everything is bilateral, everything's equal there. Alright, now maybe just put your arms out like this for me. Like this. Put it together. Put your hands like that for me, upside down. Perfect. You're not in any pain, anything like that, right?
No.
Right, now just bring it back up to like that as well. Alright, perfect. Now can you just wiggle your fingers for me? Perfect. Can you close your eyes for me? Alright, let me know which part of your, put your arms out for me, please. Down. Like that. There you go. Tell me you feel any part I'm touching.
Yeah, right hand.
Perfect.
Right arm.
Here.
Left shoulder.
Under here.
Right biceps.
Yeah, one more.
Left forearm.
Alright, perfect. Now open your eyes for me. Now just push back on my hands. Push it. Oh, Lord. Alright, perfect. Alright. Then can you squeeze my hands as well? Squeeze it.
How hard?
Okay, that's enough. Okay, perfect. Now can you just lay it back down again for me? Alright, so next thing I'm gonna check is the lower extremity. So the first artery I'm gonna check is the femoral artery. Okay, everything's +2 bounding. Next is the popliteal. Perfect, +2 bounding. Next is the posterior tibialis. Okay, next is the dorsal. Alright, perfect. Now I'm just gonna check your left side. Alright, femoral artery is +2, bounding as well. Popliteal. Great, everything's +2 bounding as well. And then your posterior tibialis again. Alright, +2 bounding. And then also your dorsal again on your left foot. Alright, +2 bounding. Perfect, perfect. Now I'm just going to check your capillary refills. I'm going to squeeze each toe and let me know if you feel any pain as well, okay?
Okay.
Okay. Okay, everything is well there. Perfect. Alright, perfect. Perfect. Alright, can you just wiggle your toes for me? Alright, close your eyes for me. I'm going to touch a part of your body and let me know which part I'm touching.
My right knee.
Perfect.
My left calf.
Mm-hmm.
My left foot.
Great. Last one.
And that will be my right thigh.
Perfect, perfect. Now, just push back on my hands for me. Perfect, perfect. All right, so now, open your legs for me. Oh, you can open your eyes as well, thank you. Okay, now lift your legs, lift your knees back to you.
Like this?
Perfect, now that way. Great, now open them wide. Put it together. Put your legs down. Put your foot down like this or so. Perfect, now lift it back up. Perfect, roll your ankles a little bit. There you go, perfect. All right, everything seems to be well. Now, I'm going to do me a favor, please. May you move over to your side, just like there on the side. Just like that, perfect. Now, put your body straight for me, please.
Like this?
No, straight like straight like that, straight down like that. I'm going to be checking.
Oh, like this.
Perfect, that's fine. All right, so now I'm going to be feeling for everything here. All right, everything seems to be fine here. Your spine, everything seems to be well here. Everything's in order. All right, I checked his anus. Everything seems to be well. No lesions, anything like that. Do you feel any discomfort down there or anything like that?
No, I'm pretty fine.
All right, everything seems to be well. Do you have any types of bleeding or anything like that?
No,
No blisters, anything like that?
not at all.
All right, perfect. All right, you can just lay back up on your pillow right here. Perfect. All right. All right. Thank you so much for allowing me to do your assessment today. I am done. I raised your bed up for you and I put the rails up. Your bell is here. If you need anything, just just ring it, and the physician will be right here. Okay? You have any questions or anything like that?
No, not at
You
all.
don't have to use the restroom or anything.
No.
All right, perfect. Thank you so much. Have a great day. Okay?
All right, thank you, sir.